Enough Vicodin equivalent was prescribed in 2007 so that every single one of the more than 300 million people in the United States could have 5 milligrams of Vicodin every 4 hours for 3 weeks.
If we don't continue to work together, we're going to lose the battle. You know, we're only keeping up at this point, and we're barely doing that.
If you have a son, if you had a daughter or a niece, and they're involved in this terrible, insidious problem, you take help from wherever you can get it. And you'll do whatever you can to save the life of your loved one. My name's Tim Cruz, and for the last 18 years I've been the district attorney here in Plymouth County, a place where I was born and raised and where I currently reside, live in Marshfield, and have been working here in the DA's office for the last 18 years, and I've been a prosecutor more than 21 years of my legal career. And many people understand what our role is here. Our role is, as the chief law enforcement official in the county, is to prosecute crimes anywhere from trespass to homicide. But what a lot of people aren't aware of are the preventative things and the things that we try to get involved in with local communities, local groups, and trying to get in front of problems so that we don't see people in the criminal justice system down the road. And one of the biggest issues we've been dealing with for the last 4 or 5 years has been the opioid crisis, which is something that needed to be addressed, and I believe law enforcement in Plymouth County anyways has stepped up.
Everywhere, particularly in the South Shore, I say we get hit hard. And why demographically it is, I couldn't tell you, but I just know that it doesn't matter if you live in the city, it doesn't matter if you live Marshfield, Hingham, Situate, Duxbury, it just doesn't matter. The drugs are available, people find them, and unfortunately, you know, they overdose, and then one of my chiefs send their officers out there, and I get, you know, I think I get a couple of notices a month that we've lost somebody or almost lost somebody to an overdose, and it's not going away. So the only thing we continue to do is to fight back.
The Plymouth County Drug Abuse Task Force was put together by myself and Sheriff McDonald back in 2015 because what we were watching are our numbers, unfortunately, on the rise here in Plymouth County as they're going everywhere in the Commonwealth of Massachusetts and New England regarding fatal opiate overdoses.
So basically this is a county-wide program where anybody that overdoses, whatever community they overdose in, their name gets put into the central database just for us in law enforcement. Before this happened, I knew about overdoses that happened in Marshfield, but I wouldn't know about any of my residents that would overdose in Brockton and then come back to Marshfield the next day. So we get notified of all overdoses and our residents that could overdose in these other communities, it doesn't matter where, and then we go out to that residence, even though it didn't happen in Marshfield, with the healthcare provider in plain clothes, knock on the door, we try to get them in treatment, try to get them a bed, and provide, you know, the best course of action for them.
So what we've been trying to do is, how can we put together best practices? How can we become a clearinghouse for our county? Because we've had a lot of really good groups in a lot of our communities that are working together, whether it be Marshfield Facts or Whitman Cares or whatever the town may be. But it seemed to me that they were really all going over the same sort of ground many times. So we thought it would be better if we had a county-wide approach and to bring in people who know more about these subjects than we do. So in trying to eradicate the problem, you have to try to educate kids in the front end, try to make sure we can teach them to stay away from these terrible drugs. We need to make sure we go after the people who are selling these drugs, the suppliers, not the users, but the people who are making money on the backs of other people who are addicted to these drugs. And we need to make sure we can get all the resources that we can to teach people in an ongoing fashion that we're going to do our best to make sure we can help people, teach people to stay away from it, teach our kids to stay away from it. So I applaud the efforts of the Plymouth County Police Chiefs, Plymouth County Outreach, and all the collaboration that's been going on in our county, which I really think that, you know, when we began it, and we had all police chiefs signing an MOU that they all agreeing to share information and also agree to get on board with this. Many times they say, you know, you can't get 27 police chiefs or 20 police chiefs to agree that it's noontime. In actuality, the men and the women, the chiefs here in our county, have really been impressive. I think that's why, even though we're in an area here in southeastern Mass which has really been ravaged by this disease, I think that's why we've been fighting it to a standstill, and I think we're getting in front of it.
My name is Kathy Epperberry. I'm a co-chair of Marshfield Facts, along with Ann Kelly. We took over for Jen when she decided to step down.
And I'm Jen Cantwell. I'm currently the secretary of Marshfield Facts. Marshfield Facts is a community coalition for substance use prevention. The idea behind a coalition is that it's a public health approach to substance use prevention.
We always try to have a different topic at each meeting, and that's something that we feel would interest the community. We did a book discussion for one of our meetings. I mean, we just try to just take anything that's hitting the news or that we feel is like at the forefront of the topic of drugs or substance abuse and bring it to our meetings. So every meeting is different.
So I'm Joseph Schran. I'm a child psychiatrist and also adult psychiatrist and also board certified in addiction medicine. I'm the chief of all the child and adolescent psychiatry programs for High Point Treatment Center. I am also the creator and founder of Drug Story Theater. So we take kids in the early stages of recovery. We teach them improvisational theater, and then we use something called psychodrama, and they create their own scripted shows about the seduction of addiction to and recovery from drugs and alcohol. And then they perform these shows for middle schools and high schools. And in between each scene of the show, the kids step out of character and they do these PowerPoint presentations teaching the audience about the neuroscience of adolescent brain development and why it's at such risk for addiction. And all the kids in the audience take a pre-show neuroscience quiz, which is answered during the show, and then they take the exact same quiz after the show. And we are measuring how kids who learn about their brain change their perception about the use of drugs and alcohol and the effect on their school, their relationships. And then after the kids have done the quiz, there's a talk back between the audience and our kids in the show. And that's remarkably powerful. The wisdom of our Drug Story Theater kids is quite amazing.
Hi, my name is Warren Nicoli. I'm the director here at the New Way Recovery Center. And the New Way Recovery Center is a peer, all pathways recovery center. We call the folks who come here peers. So we don't call them clients, we don't call them patients, we call them peers. And what they do is they decide what they want here. We make we make suggestions, but they have what we call a community meeting where they decide whether they want to have a certain group or do certain things here. So the other part that's the all pathways, which is I think the most important piece to this, is that years ago, a lot of people were very strongly into 12-step and AA and all of that. Well, it has evolved. And there's been many different pathways along the way, but we allow all pathways happen in here. So we have, we do have AA, we do have 12 steps, but we also have smart recovery. We have, a new one called refuge recovery, which is coming in. We do a couple different groups where they use the Buddha path and stuff like that. So depending on what you're into or sort of what helps you to get through, it happens in here. One of the bigger ones that we see here is medically assisted treatment. So a lot of times folks are, they're using Suboxone or Vivitrol or even methadone, and they can come in here. There's no judgment as long as they're, it's controlled well for them. So I think those are the important pieces to this. And so being the peer participatory, but also being the all pathways. We're losing so many people to this epidemic that something different has to be done. And I think this is the difference,
I am Dan Foley. I'm a recovering everything addict. I found a New Way Recovery Center, over 2 years ago. I started coming to a Smart Recovery meeting here on Thursdays and learned what the community was about here, and they really couldn't get rid of me after that, in all honesty. I started volunteering 5 days a week, and that led me into my position with the HEART program. So, HEART is an acronym. It stands for Hospital Emergency Action Recovery Coach Team. So we are recovery coaches. We are a 24-hour on-call service. We are on call 365 days a year. And, there's no holidays, no snow days. If somebody presents at Kearney Hospital, Quincy Medical Center, or South Shore Hospital for any reason, and there's a substance use component to their visit, we get called in to talk to them and just try to help them figure out their path in recovery, whatever it may be.
There's 10 of these in the state of Massachusetts recovery centers, and yeah, they're all fabulous because they all do exactly what it is. You know, they all help people. It's a different way of looking at recovery. Like for myself, I have 28 years of recovery, and everybody that works here is also in recovery. All the staff that works there is in recovery, one shape, form or another. And so, 28 years ago, this wasn't here. Like we didn't have some place to go to sort of see meetings and be in a place that's safe. If you were trying to get yourself together, you had to do it like going into like a meeting and stuff like that. So
in my role with the HEART program, I try to introduce people that I've met in the emergency rooms to the community here, because the recovery center here embraces all pathways to recovery, and it's a wonderful spot to explore different pathways in recovery. You can come here on a Thursday and experience completely different paths than you experienced on Wednesday. So if you're not sure what's working out for you in recovery or what's going to work best for you in recovery, this is a great place to get your feet wet with different options in recovery.
So the recoveries will sometimes reach back out to the coaches. The coaches try to get, their cell phone number. The coaches all have cell phone numbers, and they give that number out to each recovery. And so they're able to sort of have that communication with them. The staff that works there is amazing, and they understand.
One of the things that was brought to our attention not too long ago was Section 35 here in Massachusetts, where an individual, if they are drug addicted or if they are alcohol addicted, a petitioner, a family member, can petition the court to have that person brought into court and have that person evaluated by a court clinician. And then if that court clinician deems it appropriate that the person may be a danger to themselves or to somebody else, they could send them to Bridgewater Hospital, where they would be for allegedly up to 90 days. So in this one instance, I was notified by some of our state representatives, Representative Josh Cutler, Senator Vinnie DiMacedo, Lieutenant Governor Polito, regarding a case that occurred here in our county, unfortunately, where a young man, 21-year-old man, was petitioned to go to the Section 35 by his dad. His dad signed all the paperwork, and that young man was sent to Bridgewater for 90 days. Unfortunately, he wasn't there for 90 days, and he was released after 14 days. And when he was released, his dad had put money in his canteen account at the institution. He took his $175 and was released without notification to the petitioner, came back into our community, bought heroin, overdosed, and died. His dad had a bed for him ready to go. I believe it was down in Gosnold. And if he had been notified upon the release, he feels, and I think he's right, that they may be able to save that young man's life. So I talked to Mr. Berry, Tom Berry's his name, regarding his son. I spoke to his uncle, Dave Soper. And we all worked together with all those other state representatives, and we had a hearing eventually in a very quick fashion up in Beacon Hill. And people agreed with us that if you are the petitioner, you should be notified at the time of the release. So really, in 3 or 4 months, which is lightning speed up in Beacon Hill, a law was produced that basically before an individual is going to be released from Bridgewater Hospital under a Section 35, you must notify the petitioner and the court prior to that time, or that person cannot be released. And I believe and I hope that in the future we won't have any other similar situations where somebody is released, there's a bed waiting for them, they don't know it, the left hand doesn't know what the right hand's doing sometimes, and they're released, and we can stop another tragedy.
I thought that was a really interesting example of how, citizens worked with their lawmaker to get a law changed, and how they worked across the aisle to get it to work. And I knew both Tim and Josh were very proud of having made this change. So we're hoping to get not only Marshfield citizens, but also students studying government and students involved in the Youth in Government program to come and engage, and maybe we'll brainstorm some other laws that could be changed or improved.
Heroin's nothing new. I mean, I was a prosecutor back here in the 80s, and heroin was here then. The difference between heroin now and heroin back in the 80s is the purity of it. Back then, we'd see heroin if it was 18, 20% pure. That was considered a good bag of heroin. Nowadays, heroin's 90, 95% pure. It's absolute poison. And people are using it after they can no longer afford to get OxyContin or oxycodone and the prescription meds that are so expensive. So we've got a long way to go, but heroin has always been here. The opioid crisis has been here for the last decade or so.
So the addiction had started, typically we saw it start with OxyContin, then it moved to Percocet, and then it moved to heroin, and now it's fentanyl. So we've seen the progress towards the United States government did a great job closing the loopholes in Florida with all the pill factories down there, which dried up the pills. So we're not seeing the pills anymore at all. Strictly now what we're dealing with is fentanyl. Not even heroin anymore, just fentanyl, and you know how powerful that is.
Fentanyl is a synthetic opiate that is produced in China and Mexico that is coming into our country, and it's killing people. And the step after that, the other drug that's probably 50 times more powerful than fentanyl is carfentanil, which it really is an elephant tranquilizer, which basically would kill you if you take it, if you touch it, which is why drug officers now treat these things almost like a hazmat condition, because they have to. You can permeate your skin if you touch it, so you can't touch it. They can't allow their dogs to go in on search warrants because the dogs touch it, they'll overdose. Trying to stop them coming in the country we have to make that a mandate. And it's coming into our country through a variety of ways. We need to get in front of that and stop these drugs from coming in.
You hear a lot about fentanyl, and you hear all about that. It's just, it's too hard. It's hard to survive it sometimes because, you get a lot of, sometimes one of the things they say, and is that you'll get somebody who'll just come out of jail, or you'll see a new mom who was became pregnant, stopped using during the pregnancy, but they go back out. And what happens is the drug is so strong now that they end up dying from that. And that's the issue that we're seeing so much, is that the death rate today is it's astronomical. It's really scary, the amount of people that like somebody said earlier, one of the things is we're losing an entire generation. And I think it has to do with the fact that, the drug is cut very differently than it has ever been cut before. And a lot of times too, I don't even believe that people are really even shooting heroin anymore. I think they're just shooting, straight fentanyl.
I think both of these gentlemen can tell you that I think the drug dealers are trying to enhance their product and make it something that people want to buy. And when they do that and they add fentanyl to heroin or just sell straight fentanyl, Narcan doesn't even work on that. Not to mention you're only putting the people in risk, but you're also putting the public safety officials in risk too, is because if you simply come in contact with fentanyl, you get a reaction from it. And Narcan can't really do anything for you for that.
Yeah, we're not only putting our officers and first responders at risk, but our canines that will sniff looking for drugs often have overdoses. So we're carrying Narcan now for animals.
We got our first manslaughter conviction last year of an individual who was selling fentanyl, knowingly selling fentanyl, and killed a young woman down in Wareham. And by doing a lot of good old-fashioned police work, using the phones, getting information off the phones, able to piece those cases together. And people that choose to sell these drugs should understand that that is not a sole issue. We continue to do that and work on these cases. And if I can prove, beyond a reasonable doubt in a good faith fashion, that individuals their conduct rises to the level of homicide or manslaughter, we will come after you. I think that sends a message that we're not. They're tired of showing up at unattended deaths where people are dying because of the fact they're overdosing, and it shouldn't be happening. And they're tired of making notifications to people who tell them that their kids are dead.
I think one of the things that's important for the public to know is the Good Samaritan Act, which provides protections for those who call 911 or summons medical help for somebody that's suffering from an overdose. The idea of the law is, we saw it way too many times. There's been people suffering from an overdose that were dropped off at the fire station, dropped off at the emergency room, or even left in a hotel room without getting medical attention, because people that were with the person that was suffering the overdose were afraid to call 911 and summons, police and fire there because of the drug paraphernalia and residue that might be around. They were afraid they might get arrested. Under the Good Samaritan Act, no one who is present when the police respond to that scene can be charged with simple possession of that drug. So that's one thing we want people to know.
You will not get in trouble. If you have an overdose, it doesn't matter. You need to call 911. If you come there, you will not be held responsible for the drugs that are on the scene. We'd rather you get the help.
Another thing is there's been a change in legislation, and a law was passed about 1.5 years ago that now allows us to take somebody into custody who had suffered a drug overdose. And the reason for it is this. In the past, we would respond, somebody was suffering from an overdose, we'd give them Narcan, they'd come to, then they'd refuse treatment. Now, they don't have a choice. We can make them go to the hospital. Why? Is because that Narcan wears off after a certain period of time, and that person, if they had enough drugs in their system, could begin to overdose again. So this is to get them to a medical facility to make sure that doesn't happen, in a better effort to save lives.
You know, Narcan is this great medicine to reverse, the opioid overdose. It's not permanent, drifts away in 20 minutes. You may need to use it again and again and again, but it saved a lot of lives. I think, the most remarkable thing about Narcan for me as a prescriber is it is the only medicine that I prescribe where I expect the person I'm prescribing it to use it on someone else. It's the only medicine that I'm okay with diverting. There isn't any other medicine that I prescribe where I encourage somebody to say, yeah, I'm going to give this to my friend. But pretty much every one of the kids that comes out of my substance abuse program walks out with a prescription of Narcan because they're probably going to come in touch with somebody who needs it. Hopefully not them.
You could go to the pharmacy, you could go to the police department, you could go to the fire department. I'm not sure they'll get it for you. Not to mention that I know that Chief Tavares and Hockey had a forum publicly where representatives were here that had free Narcan if you wanted to sign up. And I saw people signing up for it, and some of them were family members, and unfortunately I think some of them were probably putting it away in the event that they overdose. But we'd rather you have it than not have it.
Depending upon how strong the fentanyl is, sometimes the Narcan isn't effective, depending on how long they've been down too. Because the natural progression is, they overdose, slows the breathing, they go to respiratory arrest and then into cardiac arrest.
Yeah, one of the things that I want to point out is that when you look at the amount of overdoses 1 year compared to the next year or this year compared to last year, that is only what's reported, because there's so many times that people are using Narcan at home now that never had it before, and they're being treated at home or at a different location, and the police ambulance is never being called. So you can't really get an accurate figure on how many overdoses we're really still having or have had compared to year.
And I would just, like people to know that Narcan's great, but it's not magic. I mean, you don't just give them the Narcan and everything's well. I mean, you could give them the Narcan, it doesn't work, then you have to do some rescue breathing. So there's training that actually goes along with the Narcan. It's not extensive training, but it's enough to recognize and know what you have to do. Do you have to assist with the breathing? Do you have to do CPR when they go into cardiac arrest? So people should realize that, once you get the Narcan, get the little training that goes along with it, and you can save lives.
Myself and Sheriff McDonald put together prescription medication boxes throughout the county of Plymouth. And now, as we sit here, there's a prescription med box in every police department in Plymouth County, except for Plimpton, because Plimpton didn't have a big enough lobby, but they're getting a new police station, so I'm hopeful that the new station will be big enough to have the med return box, to allow individuals to, at any time, 24/7, to bring it to a safe, secure facility, to get rid of their unwanted, unneeded, unused medication. Because many times we find out that people, unfortunately, if you get medications, which may be addictive medications, say it's your grandparents or whatever, and they're putting them in their medicine chest, they may forget about them, they may believe they're expired, and they're just sitting there. So how do you get rid of that stuff? There's people say, well, I'm going to take them and flush them. Well, that's not environmentally sound, so we don't do that. There are some, as I understand it, some chemicals out there now that you can put to them and destroy them, but I don't think that that's as prevalent as it used to be. So by doing this, by working in conjunction with Covanta is located in Rochester, Middleborough, and they will destroy these drugs. We keep track of them just like we do for a drug case, where they're all synchronized, we have their numbers, we know 5 pills come from here, and then they go there to Covanta, they destroy them, and they can make that into renewable energy. So it's kind of a twofer that you can do it that way. And we've had, I don't know, hundreds and hundreds and hundreds of pounds of unwanted, unneeded, unused medication go that way. the other things we've been doing here in our county at some of the high schools is dealing with sports med. And talking to, right now, if you're going to be an athlete in high school, pursuant to MIA rules, you have to go to a class that they're talking about concussions. What we've been doing, we've been partnering up with Dr. Muse from Signature Healthcare, and we also talk about prescription medication and how if you get hurt, if you hurt your knee, you tweak your shoulder, whatever it may be, you don't have to take these medications. You can get through them. Because lots of times, especially at the outset of the opiate problem, a lot of these people were taking medications which they thought, well, it's prescribed to me, it can't hurt me, and they were taking it without realizing the effects of it. So I think now that there's a bigger realization from people that they are dangerous drugs and that they have to be taken, if at all, in limited quantities. I mean, because OxyContin was, I mean, I think there was a good cause to that at the beginning. It was dealing with cancer victims and the pain they were undergoing. It's just the way that it was subsequently promoted and spread out that it turned into this huge problem across our country. There remains incredible challenges, and what I see in my business from doing this job for a really long time, and the thing that I'm always concerned about are the cycles of the problems that we have. The cycles of domestic violence, the cycles of child abuse, the cycles of individuals who come from drug families, kids whose parents use themselves, and the drug-endangered kids that are there. So what we've been doing in Plymouth County, we were actually got a mini grant from the Attorney General's office, in which we are teaching now to the Harvard University, the Trauma and Learning Initiative, in conjunction with Mass Advocates and also the Mass Teachers Association, teaching schools how to become trauma-sensitive schools for the kids who are at risk, and dealing with the kids who really are the most at risk. And those are the kids who have these ACEs. The kids who perhaps their parents have overdosed, their parents have passed away, their parents have gone to prison, they have been beaten, they have been hurt. Every one of those issues becomes an ACE. The more ACEs you have, more likely than not you are going to be a drug user, and probably an intravenous drug user by the time you hit a certain age. So how do we help those kids and get them the information that we need to? We started this program 10 years ago. We started with kids who were victims, really, of gang and drug violence and gun violence here in the city of Brockton. And by doing and making 3 schools here, trauma-sensitive schools in Brockton, they saw their referrals to the office in those schools go down by 80%, because teachers were learning how to deal with these kids versus, okay, you broke a rule and therefore it's a mandatory 3-day suspension and you're going home.
The town is definitely working in conjunction with the fire and police chief, the district attorney, the sheriff's department, in an effort to find ways to enhance the communication. For example, the town just added a grant writer position. One of the things that I discussed with the town administrator is I wanted them to hopefully find grants that help us fund these departments, because it's a strain on their resources, but they have to do it.
We have groups like Marshfield Facts, Situate, we've got a whole bunch of people now. We've got a governor that's involved. We've got senators and congressmen and state reps and selectmen and people in positions of power who are trying their best. But I think it's still difficult for a community to accept that it would be in my backyard.